श्री सदानंद महालू सेठ तानवड़े जी।
Thank you, Speaker Sir. The Central Excise Amendment Bill 2025 is a necessary fiscal and public health intervention aimed at ensuring that the GST compensation cess is phased out. As was agreed collectively by states, tobacco products do not suddenly become cheaper and more accessible. The government intention is not to impose new burdens, but to preserve the existing deterrence against harmful consumption and maintain stability in pricing to prevent a rise in addiction, especially among the youth. Tobacco remains among the leading causes of non-communicable diseases, including cancer, heart disease, and respiratory illness, creating enormous social and economic costs for families, particularly for lower-income households who part with their savings merely to access treatment. International experience shows that price-based deterrence through taxation is one of the most effective tools to curb tobacco usage. This legislation reflects that evidence-based approach. Higher and stable taxation directly protects adolescents, students, and economically vulnerable population who are the most price-sensitive and therefore the most likely to initiate tobacco use when products become cheaper. Cheap tobacco is not about personal liberty. It is about creating lifelong addiction pathway for new generation. The bill fully respects the structure of fiscal federalism. The GST compensation cess was by design a time-limited instrument. Its conclusion does not dilute the rights of states. Under the Finance Commission framework, states continue to receive 41% of the divisible pool, a historic increase implemented under the Modi government, ensuring fiscal stability at the state level while maintaining national revenue balance. For Goa in particular, the legislation assumes special significance. The state is witnessing an upward trend in cancers and lifestyle disease linked to tobacco consumption, increasing pressure on district hospital and tertiary facilities including the Goa Medical College. By preserving tobacco price deterrence, this bill strengthens both prevention and long-term sustainability of healthcare system that serve Goan families. As a tourism-driven economy, Goa also bears the responsibility of promoting healthier social environments for residents and migrant workers, like especially in hospitality, transport, and service sectors, where occupational stress often increases vulnerability to tobacco addiction. Preventive policy today reduces future health burdens both for our state and the country. Importantly, this bill must not be misunderstood as being anti-farmer or anti-worker. The intervention targets consumption, not livelihoods. Crop diversification schemes continue to support tobacco farmers in transitioning toward alternative and sustainable agriculture. With over 1 lakh acres already shifted nationally, providing that public health protection and farmers' welfare can advance together. Concerns regarding illicit trade have also been directly addressed. The government has strengthened the track and trace system, implemented digital tax stamping, and enhanced operational coordination between customs, GST authorities, and the Directorate of Revenue Intelligence. These measures have already resulted in record tobacco smuggling seizures, indicating growing enforcement capability under the NDA government. The bill aligns India with global public health standards recommended by the World Health Organization and other international best practices, ensuring we do not lag behind developed nations in safeguarding public health. Ethically, the legislation also reflects balanced governance, collecting revenue from harmful non-essential products while easing burden on the middle class and keeping taxes low on essential commodities. It is both economically prudent and socially responsible. Or as India marches toward the vision of Vikasit Bharat, health protection must walk alongside economic growth. Addiction weakness productivity, disrupt families, and drains financial stability. Investing in prevention today preserves a healthier, stronger workforce tomorrow. The Central Excise Amendment Bill 2025, therefore, stands not merely as a tax measure, but as a strategic public health intervention, a fiscal stabilizing instrument, and statement of ethical governance, one that safeguards our youth, strengthens our healthcare institutions, respects state revenue, and advances the collective goal of building a healthier India. Thank you, sir.
Thank you.